Today, people have so many options when it comes to looking at private ADHD assessments. I often get asked the question as a consultant psychiatrist, well, what should I consider? Remember, private ADHD assessments can vary in price all the way from £500 to £3,000. So what should you be looking at? Does it matter? And are they any different? And the answer to all of these is yes. So the things that you should be looking out for are: who does the assessment? How long is the assessment process? How is the assessment completed? And what kind of report, if any, is provided? So let's start off with who should complete the assessment. When a consultant psychiatrist completes an ADHD assessment, not only do they look at the ADHD symptoms and severity, but they also look at other mental health disorders such as depression, anxiety, OCD. It is really, really important that consultants rule out other mental health disorders as a cause of ADHD symptoms. What we know about adult ADHD is that 60 to 70% of adults have a comorbid mental health problems, meaning that they have other mental health problems alongside their ADHD. Being able to evaluate this and communicate this to patients is extremely important. In terms of how long an assessment process should be for ADHD, a good assessment should be at least 2 hours long. One, you need to evaluate the symptoms of ADHD, the impact on an individual's life, but you also have to look at their neurodevelopmental history, look at their childhood, the pregnancy. You have to look at their school years. There is a lot of information to gather before an ADHD diagnosis can be given. How an assessment should be completed in the UK is following NICE or national guidance. This means appropriate clinical questionnaires should be sent out to individuals and family members, alongside using supportive diagnostic tools, including the DIVA or the QB. And lastly, what should a medical report consist of for ADHD? A comprehensive medical report is absolutely a requirement for a good ADHD assessment. This allows an individual to understand their symptoms and severity and their diagnosis, but also allows them to have good treatment recommendations put in place to help support them on the next step of their journey. A medical report that is shared with their national clinical provider, like the NHS, allows for transfer of care to the NHS, but also increases the likelihood of shared care with GPs. So at Diverse Diagnostics, when we do an adult ADHD assessment, it is a consultant-led appointment. We follow national guidance and we use all the same clinical tools that the NHS does in terms of when they do their adult ADHD assessment. We also provide the option of using a computer-based cognitive test such as a QB to help support the diagnosis. At the end of every assessment process, a very comprehensive medical report is provided to the patient and is sent to the GP as well. This allows the NHS to be aware of the challenges an individual has and can continue to support an individual. If a patient chooses to do treatment with ourselves, we are able to provide medication, therapy, and ADHD coaching.